Hello friends, so I am Dr. Amit Gupta. I am a Senior Consultant Cardiologist at Manipal Hospital, Palamvihar, Gurgaon, and I am a specialist interventional cardiologist, and I deal with heart attacks, heart failure and all related diseases regarding the heart. And today we will be discussing about coronary artery disease, or commonly, which in layman language is called as blockages in heart arteries. So I would just like to show you a model of coronary artery, and I'll tell you what exactly we are discussing about. So here I have got a model of coronary artery, and the inside of coronary artery, what it looks like. So this is inside of the coronary artery. The blood vessels or the RBCs, blood cells, they all flow inside the artery, right? So this yellow dots, what we are seeing, these are cholesterol particles. When they starts to get deposited in the coronary, inside of the coronary arterial system, this leads to blockages. When the blockages gradually increases in size like this, they will obstruct the blood flow. When they will obstruct the blood flow, then this leads to the insufficient blood flow going to the distal part of the heart artery, and which leads to heart attacks, blockages and angina, symptoms of chest pain and all. So this is what coronary artery disease is actually, deposition of the cholesterol particles inside of coronary artery. That's a very important question. Actually, these days, the coronary artery disease, what we are looking, has shifted its age group. Now, earlier, what we used to see was that heart diseases used to come in after the age of 50 years. But now, even 30, 35, 40, 45, these young age group people are also suffering from heart disease. Who are those people who are actually at higher risk? First of all, the diabetics. Diabetes patients are especially at very high risk of developing heart disease. Hypertension, blood pressure, smokers, people who smoke 10, 12 cigarettes every day. Not only they are at a risk of developing heart disease, they are at risk of developing lung disease as well. Then high cholesterol, the people who are having high cholesterol levels, they have to get worried. People who are having strong family history of heart disease, the people who are having family history of getting early, like if the parents or somebody in the near relatives, if they are having heart disease at the age of 40, then the risk of heart disease in next generation is also higher. The classical symptom of coronary artery disease is left side chest pain, which radiates to left shoulder and left arm. This is a classical symptom. Otherwise, there may be other symptoms which may be similar. Chest pain may be in the center, midline, not necessarily on the left side. It may sometimes be on the right side as well. The pain can radiate to left shoulder, it may radiate to jaw, it may radiate to teeth, lower teeth, it may radiate towards the back, and sometimes it is very often confused with gastric symptoms as well. Burning of heart, going towards the back, vomiting symptoms, sweating. These are the classical symptoms of coronary artery disease. Prevention of coronary artery disease is actually prevention of the risk factors. So the people who are at higher risk of developing coronary artery disease should control their risk factors. Now, as I said, diabetes is one of the very important and most important risk factor. The people who are diabetics should take care of their sugar levels. The diet should have low sugar or almost no sugar diet. The people who are having high cholesterol levels, they should check about the fatty contents of their diet. So diet is one part where which has to be checked. Diabetes people, they should check their sugar levels often and control their diabetic status. Hypertension patients should control the blood pressure by means of lifestyle changes, and by medicines. Lifestyle changes, what can be done is do exercises on a regular basis, at least 45 minutes to 1 hour, 5 to 6 kilometers every day. Then diet has to be seen, low salt, low fat, low sugars. And smoking is one of the risk factors. Then stop smoking, because we see that smokers are more prone to develop coronary artery disease. And daily exercise, doing physical activities, that should be done as lifestyle changes for coronary artery disease. Now, first of all, the person who is having symptoms of chest pain, which radiates towards shoulder, arm, and other symptoms which I have already explained, if those symptoms are coming, then they should consult the doctor to get evaluation done for the coronary artery disease. Now, how do we do it is, first of all thing is ECG. If the ECG is showing an abnormality, then further tests which are performed to check are like echo, stress echo, treadmill tests, and angiography. So these are few tests which are done to diagnose coronary artery disease. So the coronary artery disease, when I say, I'm talking about the deposition of cholesterol inside the coronary arteries. It can be cured in the sense that the blood flow which is reduced because of the deposition of cholesterol, that blood flow can be improved by doing certain procedures like angioplasty and stenting, or by doing bypass surgery. So by these methods, blood flow can be maintained across the blockages which have been there. The cholesterol deposition actually remains there, but the cholesterol deposition is removed from the way of blood flow by doing a stenting or a bypass surgery procedure. I hope the answers given in this video will be useful to you. Information given in this video will be helpful to you in your daily routine. If you have any comments, if you have any questions, please put them in the comment box. I will be more than happy to answer them. Please like the video, share the video, and subscribe the channel. It will help us create more informative content for future. Thank you.